The COVID-19 pandemic is more than a health crisis. It is an economic crisis, a humanitarian crisis, a security crisis, and a human rights crisis. This crisis has highlighted the severe fragilities and inequalities within and among nations. Coming out of this crisis, we require a whole of society, a whole of government, and a whole of the world approach driven by compassion and solidarity. According to the Secretary General of the United Nations, there is a roadmap to recover better together.
Sustainable Development Goals give us an inspiring blueprint for recovering better. We face colossal challenges. With global solidarity and cooperation, we can overcome them. That's what the United Nations is all about.
As part of the response, the UN Secretary General has issued policy briefs to provide ideas to governments on how to address the consequences of this crisis. Policy briefs by theme are food security and nutrition, people on the move, mental health, human rights, debt, socio-economic impacts, jobs, cities, tourism, inequality, education, and universal health. The UN is targeting all population groups, people with disabilities, older persons, children, and women in Africa, Arab states, Southeast Asia, Latin America, and Caribbean. In Rwanda, the UN country team has been walking the talk throughout those policy briefs since the outbreak began in March in a country of 1,000 hills. In collaboration with the government of Rwanda and developing partners, the UN efforts to fight the COVID-19 pandemic is continuous. The UN in Rwanda has provided both financial and technical support to respond to COVID-19 and build back better.
The government of Rwanda is one of the governments in Africa and also globally that has been commended for the COVID-19 response. One, the response was very swift with a lot of high-level decisions made very quickly in the epidemic. From the time when the first case was detected in March, the government quickly moved to ensuring that all measures were in place, public health measures were in place to be able to rapidly respond to the epidemic. Even before the first case was detected, there was already a plan in place. The support has been very well coordinated through the Office of the Resident Coordinator. The different UN agencies came together very quickly and put up an amount of money that they thought would be able to help, as well as technical support that the UN was able to give. For example, the use of robots, the use of drones, and other digital solutions in contact tracing. Other areas where the UN has contributed has included in the leadership and coordination. WHO, for example, has had people who are working in the National Command Center and also in the provincial command centers. And thanks to different partners across, beyond the UN even, have been contributing different amounts of money to this plan. Then as the pandemic has gone, there has been additional needs which have come up beyond what was anticipated earlier, which further increased the price tag. So there is still a gap in funds which are needed. The pandemic is still far from over. We expect to still be fighting it in the coming year.
Between March and September 2020, the UN has mobilized more than $19.6 million. In addition to the financial support, the UN has supported the development of the National Preparedness and Response Plan, the Socio-Economic and Recovery Plan, provided the policy advisory services, conducted the socio-economic impact assessment of COVID-19, to name a few.
We received a strong support from one UN family. We received almost $19 million since the beginning of this pandemic, COVID-19. So this support was in different type of categories of support. We received resources for financial resources. We received in-kind resources. We received technical assistance support, especially with experts to assist us in training our lab technician at the beginning of this pandemic, which was completely a new pandemic. We also received in-kind resources, especially for the prevention of COVID-19 among health staff and the rest of the population, being PPEs, personal protective equipment, being medical and lab equipment for us to treat COVID-19 patients. We also especially received kind of support for access to international procurement platform for us to procure with the government resources what we required at the COVID-19 commodities. So the support was really a strong one, including some vehicles to increase our capacity to deploy our staff in remote areas. Challenges we are facing with for COVID-19 is that so far we don't have vaccine. Another big challenge is that the country needs to continue to provide to its population what they need. We need to keep international trade, we need to keep our borders somehow with interconnectivity with other countries. So of course UN support is required to support us as we extended recently our COVID-19 response for the control of this disease. Some additional resources are required, so we need additional support again in terms of advocacy, because we need to have access to the platform of vaccine. Of course, UN family will be very, very supportive for us to be on the list of countries receiving those vaccines. We commend the partnership we had so far with UN family, especially during this time of COVID-19. We appreciate how UN family was responsive, being aligned, their support was aligned to our preparedness and response plan. It was timely provided, it was comprehensive, with intention to strengthen our health system. So we wish to continue with this partnership with the UN family.
The one UN support to Rwanda is divided into 5 categories: health support, socio-economic response and recovery support, human resources and innovations, in-kind contribution, and staff voluntary contributions. Other UN agencies in Rwanda have contributed in those categories on this joint program of socio-economic and recovery plan on the COVID-19. From March to September this year, there are some key milestones at agency level that cannot go unnoticed. In line with the recovery plan set by the government of Rwanda, which aims to save farmers from the effects of COVID-19 by improving productivity and food security, Food Agriculture Organization distributed vegetable seeds in Muhanga and Kalonji districts to help farmers recover from COVID-19.
Mu gihe iki cyorezo cyugarije isi yacu, umuryango FAO wagerageje kudutekerereza kugira ngo tubone uburyo duhinga imboga, twebwe tuzarya, tugurishe, kandi noneho dufungure n'abavandimwe bacu hirya no hino batameze neza. Turashimira umuryango w'abibumbye wadutekereje kudutekereza kugira ngo tugire imirire myiza.
The support of one UN Rwanda has not left refugees behind. In Nyamagabe district, southern Rwanda, UNHCR, UNICEF and other partners have supported in building COVID-19 treatment center. The newly constructed COVID-19 treatment center is operational since 20th August. This center is helping both refugees and host communities. Before its establishment, COVID-19 patients from Nyamagabe had to be transferred in Rusizi district in Western province. For former patients, the treatment center was a very great rescue.
Bagiraga ubwoba yuko batazakira, ariko nje mvuriwe hano hafi y'iwacu turakira cyane. Narishimye cyane bitewe yuko nayo nzigaranye ni famille yo nari nduranye nayo.
The worst thing about this pandemic, it is that health-wise, it affects vulnerable people with existing underlying health problems, and economically, it heavily affects those ones who initially lag behind in development, like people living with disabilities. It is this group of people that the United Nations Development Programme considered in its effort of not leaving no one behind. The UNDP has given a capital injection to Deaf Women Cooperative. The cooperative that is in the tailoring business has managed to buy sewing kits.
When the government confirmed that there is COVID in Rwanda, there was a very big problem because the cooperative, the business had to close. We had to stay home and we are unable even to get what to eat. We are stuck. We thank UNDP for the great support that was given to us, because this has helped to support our livelihood. We are able to support our families. We have kids at home. We are able to buy food, and we will be able to pay school fees as well.
COVID-19 is just exposing pre-existing gender inequalities. In part of UN Women's response, it partnered with the Rwanda Chamber of Women Entrepreneurs to launch a business clinic to provide strategic guidance and business advisory services to women entrepreneurs who were facing great uncertainty in their businesses due to COVID-19. The business clinic started with 30 women entrepreneurs. Now it has extended its services to 100 women throughout the country.
During COVID, everything came to a stop. We were to reduce the staff. If we had like 10, now we cut down to 5, and then we went down to 3, and COVID was really bad by that time. Through the business clinic, we are now not closed inside in knowing that we have problems, but we know through the problems we now have answers.
The COVID-19 pandemic is a shock to everyone, but there are certain groups of people who were hard affected. Among them, people living the HIV. When movements were prohibited during the lockdown, these people could not easily access medication. Peer educators who usually visit them regularly could not move. They had to travel, which ended up making them involuntarily reveal their HIV status to be able to pass through roadblocks. For them, it was a dire condition. Thanks to the United Nations program on HIV and AIDS, the Rwanda network of people living with HIV has now a call center where people living with HIV call for free and ask for any support they need in their privacy.
The call center allowed us to know the issue around socio-economic issues at the community, and the call center helped us to know how many really are on need of food support. And UNAIDS was one of the agency within the UN that supported to advocate.
In a bid to keep safe the ones who keep us safe, the United Nations Population Fund, in collaboration with Allied, have been providing personal protective equipment to nurses, midwives, and other health workers in Rwanda.
Thank you so much. Thank you so much for your support. Thank you so much for your commitment towards responding to the issues of refugees. And we thank UNFPA for being there.
You can't talk about the provision of personal protective equipment without mentioning the support of World Food Programme. With WFP, protective equipment and food support were transported to different destinations. During the lockdown, vehicles and aircrafts of WFP didn't stop days and nights. For all of these to happen, the WFP have to establish and strengthen partnerships with different development partners. One of them is Trademark East Africa.
And we hope that the collaboration will continue not only for this pandemic, but even going forward. The partnership will ease movement at the borders, as well as facilitate access to humanitarian assistance.
On the other hand, as the highly skilled Rwandan workers were fighting the COVID-19, the United Nations Children Fund was working with the Rwandan government days to find an innovative way to keep educating future Rwandan professionals. COVID-19 had closed the classes, but thanks to UNICEF, children in Rwanda got teachers in radios and on other online platforms.
Muri ibi amashuri afunze natangiye kwigira kuri televiziyo na radio. Nkunda amasomo atangirwa kuri televiziyo na radio, cyane cyane kuri televiziyo kuko umwarimu aba ariho kandi turebana agasona tumira bakadufasha.
COVID-19 has forced the world to migrate from routines to new normal. The government of Rwanda has been trying to foster a cashless economy and promote financial technology companies that economic transactions can move to online. The UN Capital Development Fund shares with the government the same goal. During the COVID-19 period, with the Ministry of ICT and Innovation, UNCDF has stepped in to support fintech companies. This partnership resulted in the establishment of a virtual fintech incubation hub with a goal to support fintech companies to move from prototype level to scalable and investment-ready projects.
We have received the support from UNCDF in terms of advancing fintech startups in Rwanda, and I would say that that support contributed heavily because most of the sectors have been affected by COVID-19. Usually it's not easy to get someone who is supporting you in innovation. Most of the people are coming to support you when you have something already.
The UN support to the government of Rwanda is also on individual level. As of September 2020, the UN family has raised individual voluntary contribution of more than $12,000 to support the population that is most affected by the pandemic. Apart from financial contributions of the UN staff, the ones on the field are also very eager to support the Rwandan community.
As an active member of my community, I am bringing my modest contribution to mitigate the impact of COVID-19, supporting the daily distribution of food to members of my community, especially households with no access to food and basic services. I feel fortunate to serve my community and encourage each one to bring their contribution at this difficult time.
I wish to thank and commend the government of Rwanda for the tremendous work done so far, which has yielded results. Kudos also to development partners and to the UN family, our collective leadership and the colleagues for putting their synergies to achieve those results. There is a lot more to do, and this joint program is really calling on enhancing our partnership in building back better and greener by supporting resilience of institution and system and communities to resist the shocks and bounce back. It's important we sustain the gains and also support the continuous implementation of the national strategy for transformation in achieving the SDGs. Thank you very much. Merci beaucoup. Turi kumwe.